So let's talk about addiction. To me, addiction is a much simpler problem because in 2007, a gentleman named Barry, that's not his actual real name, he, in the 6th week of seeing me, so he'd had essentially 5 treatments, he asked me in a very strange way if this would help with addiction, which I did not know at the time he had any addictions. And he had addictions to alcohol and cocaine. And so he leaned over in this kind of fashion. He looked left, he looked right, and he asked me this question: is calibration supposed to help with addiction? And then he said, is that a strange question? I said, yes, that is a strange question, because it was something completely unanticipated by myself. And I said, well, what happened? He said, I lost the desire to drink. I said, you mean it just went away? Is that what you're saying? He said, yeah. And he said, that's not all. I said, well, what else happened? He said that he thought he should try to drink again just to see what would happen. And it made him sick. And he never went back to drinking again or using anything else again. And as a first time happening in 2007, really got my attention. And eventually I started to work in an outpatient and an inpatient facility for addiction. And it became very clear to me that the driving force of addiction is stress. Stress born of an unrecovered trauma, which changes the physiology of the body in breathing and sleep and so on. So with the addicted population, if you interview them, and I have, what will happen is that you'll find a memory that they had of a trauma. And about a year, maybe 2 goes by, usually just 1 year, before they start using and becoming addicted. When that happens, the machinery of the brain changes in a radical way, and most people will tell you that once addicted, the shift is permanent, you don't come back. And I believe that that's true. However, stress is the driving issue that causes people to use. How we know this is that after thousands of patients gone through calibration, in just limited fashions, the stress comes down so far that they can no longer see themselves using. And if you ask an addict if they've been recovered for 6 months with no calibration, you ask them, can you see yourself using? Are you afraid that that might happen? Universally, it's yes. A calibrated person who's in recovery, they even appear like they can't relate to that lifestyle anymore. So something powerful is really taking place in the body and brain in relation to addiction.